Thank you for joining this episode of UAB Medicine's Post-COVID Lunch and Learn series. Today, Dr. Turner Overton, Professor of Medicine in the Division of Infectious Diseases, will be sharing with us an overview of COVID-19 and post-COVID. Please submit your questions in the Q&A, and if time allows at the end of Dr. Overton's presentation, we will try to answer as many questions as possible as he can that relate to this Lunch and Learn. For those of you new to Zoom, you will find the Q&A button at the bottom of your Zoom window. I will pass this over to Dr. Overton. Dr. Overton?
Yeah, hey, thank you so much, Jennifer. Hello, everybody, and thanks for joining us today. My name is Turner Overton. I'm one of the infectious disease doctors here at UAB, and I'm really excited that we're starting this series to cover post-COVID. Last year in March, we started seeing our first cases of COVID-19 here at UAB, and quickly we started seeing cases in our employees and widespread throughout the community. And so we've been, fighting this pandemic over the last 15 months. One of the things that we've learned is that a significant proportion of people are left with symptoms after the acute COVID-19 infection. In fact, we established a clinic where we could see people with acute COVID safely. And what we quickly realized that many of these people were having durable or persistent symptoms. And one of the biggest challenges about that was the anxiety and the stress of not knowing what to expect with the disease. And so over the course of time, we've developed a program whereby we can get these individuals referred to specialists to help with their symptoms. Nevertheless, among the community at large, I find a lot of people are still very anxious and concerned about these symptoms, and there's a limited amount of data and information coming to patients. So we developed this webinar series to be able to raise awareness about post-COVID symptoms. And we've got subspecialists from a number of different specialties who will be coming to you over the next 8 to 9 weeks. To give a more focused update. Today, my focus is going to be an overview of COVID-19 and post-COVID symptoms. And then as you can see here on this slide, between now and August 4th, we'll have subspecialists for many of the areas where we see a lot of common symptoms that people have. And so the hope is that we can raise awareness and understanding of what the post-COVID symptoms are, what people can do to ameliorate these symptoms, and how they can get engaged in care if they're having persistent or worsening symptoms. So I certainly hope you'll enjoy today's talk, but then we'll come back and join us for these additional webinar series episodes that'll be more targeted to specific symptoms. So just to start with kind of a big picture about coronaviruses, just so people are aware, this is a family of virus, and there are a significant number of viruses in this family. In general, these viruses infect warm-blooded animals, so mammals and birds. These coronaviruses are frequently seen every year. They're more common in the winter as a family, and usually they cause a mild common winter cold. So about 15% of the common winter colds are due to a circulating coronavirus. And the name is really descriptive. When these viruses were first identified under a microscope, they look like a circle with a crown on the top. And so corona in Latin means crown. And so these were called coronaviruses. Now, in the last 2 decades, we've seen 3 of these coronaviruses now cause severe illness. The first being SARS in 2002, which people might remember, and it caused extremely severe disease and had a high mortality rate. Because of that, it wasn't a very effective pathogen. It's spreading through the community, and it sort of burned itself out by 2004. Since then, we've not seen any more. But it really raised the alert to people in the field to recognize that this pathogen was one that could jump from animals to humans and cause severe disease. The second one, which was MERS, or Middle Eastern Respiratory Syndrome virus, actually was transmitted from camels to humans. And we continue to have sporadic cases ever since 2012, when we first saw it jump from animals to humans. Now, more recently in 2019, we saw another coronavirus that was able to jump from animals to humans. And this is SARS-CoV-2, the virus that causes COVID-19, and what has caused this pandemic for the last 15 months that we've been battling and fighting against. And so you can understand why there's concern about this group of viruses. Now, this virus, as opposed to the initial SARS virus, has a much broader kind of presentation. So while the majority of people have mild illness and it's usually self-limited, about 20% of people will have a more severe presentation. And what we've learned over time is the people who are more likely to have severe disease include certain groups, like people who are over the age of 65, particularly people who live in group homes and nursing homes. In fact, that's the group that we've seen the most severe outbreaks in before we had the vaccination. And strikingly, nursing home residents also have had the most benefit from vaccination in terms of preventing disease. And then certain people that had chronic medical conditions were also at greater disease. So obviously, because this is a respiratory illness, people who have chronic lung diseases like asthma or COPD, people with high blood pressure, diabetes, or heart disease, and people with other end organ disease like chronic liver disease, chronic kidney disease, people with a history of a stroke, and then people who have significant obesity, and also a notable group of people who are immunosuppressed. Now, for most of these people, they do okay with the illness, but they are just at higher risk to have severe disease and to require hospitalization. So as you recall, these were the groups that were targeted initially when vaccines came out, because we were really trying to prevent severe disease for these individuals. The striking thing about these individuals is this also puts some of these individuals at greater risk to have post-COVID symptoms. And part of that may be attributable to having a more severe disease. It seems that people who are hospitalized or have more severe disease are more likely to have long-term consequences or persistent post-COVID symptoms. So, just to give you some numbers, here's a picture of Alabama and our case rates. And what you can see is, as a state overall, we're doing much better. If we looked at this very same map, a heat map of how many cases we have, the whole state back in March and even into April was red. So we've had a much and a darker hue of red than that. So what you can see is we've had a reduction in cases. Now, I don't want to minimize the amount of disease that we've seen. I checked again this morning, and there are now over 171 million cases of COVID-19 diagnosed around the whole world. And that's probably an underestimate because many places don't have really good testing. And there are now nearly 3.6 million people who have died as a consequence of COVID over the last year and a half. In Alabama, we've had about 550,000 cases now and over 11,000 deaths. So, when you think about COVID, I think it's affected all of us. We've all been affected one way or another, either directly or indirectly. And there are lots of consequences to that. Now, the good news is we've seen our case rates really decline over the last several months. And so I think that reflects a lot of different things. I think people have become more aware. The rollout of vaccines since December has contributed to that significantly. And also, I think we've had warmer weather, people have been able to go outside where the risk of infection is lower. Once again, I just want to highlight that the majority of people, about 80% of people who get infected with COVID-19 virus have mild cases and that are self-limited. Now, about 20% of people have severe or critical disease and require a trip to the emergency room or hospitalization. And so it's still a high proportion of people. The acuity of disease we see remains high. It's just that the overall burden is lower. And that's thankful for both our hospitals and our care teams who are managing these patients. So I think because this is a respiratory virus, and we're thinking about what people present with when they have a respiratory virus, we commonly think, symptoms of a common cold. So a sinus headache, congestion, and sore throat are common symptoms that people have when they have acute COVID. And sometimes that's hard to tell from any other cold, or maybe even this year we had a high pollen counts from your seasonal allergies. But other presentations also happen with people. Some people have more of a flu-like illness with fevers, chills, or body aches. Other people with more of a respiratory presentation like cough, fever, or difficulty breathing. It's not uncommon for people to have a GI presentation with nausea, vomiting, or diarrhea. And then we've had many people who present with their only symptom is a loss of sense of smell or taste. And that's when they seek testing, because we know that's a common manifestation of the illness. The overwhelming majority of people who have acute COVID infection have fever. About 90% of people will ultimately have a fever. Now, that being said, not all of these people have a fever when they first present with illness. And so if we use that as the only symptom to try to identify people, we're going to miss people. But you can see, if you look down this list on the right of my screen, you know, the symptoms are myriad. They involve many different symptoms of the body. And so you may say, well, why is that? There's a couple of reasons for that. The first being that this virus not only infects the respiratory cells, but it also has the ability to infect cells of our vascular system. And because of that, you know, all parts of our body are receiving blood. And so there's vascular tissue everywhere. There are arteries and veins going to all of our tissues. So it's possible for the virus to reach all areas of our body. And those that are more highly vascular are more likely to be affected. In addition, there's an inflammatory response to the virus. Our immune system responds very briskly to the virus and can induce an anti-inflammatory response. So some of the symptoms that we see may be more related to that immune response or inflammatory response than to the virus itself. And so when we start thinking about post-COVID, when people are over the acute phase and we see ongoing symptoms, a lot of those symptoms are more due to the response of your immune system than to the virus itself. So a big challenge about defining post-COVID is that we don't have a timeline or specific designations for the different periods. The European group called the NICE group came up with I think what is the best classification that we have currently, which breaks COVID down into 3 different periods. So acute COVID-19 is usually the first 4 weeks of the illness. Now, in general, most people are only infectious for about 10 days after their symptoms develop. And so in other words, they're only shedding virus for the first 10 days or so. But nevertheless, they continue to have symptoms for up to 4 weeks. Now, there are a couple of groups who may shed virus longer. First, people who have a more severe illness, particularly those that are hospitalized and require an ICU admission, are more likely to shed for up to 20 days. And similarly, those patients who are immunocompromised, either because of cancer treatment or some underlying treatment, like for a rheumatologic condition, may also shed virus for up to 20 days. So, but however, these symptoms of acute COVID usually last up to 4 weeks. And fortunately, for most people, those symptoms resolve. But there's still a significant number of people who have ongoing symptoms beyond that. And this group in Europe, what they developed is they split these post-COVID symptoms into 2 groups. The first being individuals who had ongoing symptomatic COVID beyond 4 weeks and up to 12 weeks after the onset of their illness. And so they classified these as ongoing symptomatic COVID, and then put people who had symptoms that are ongoing after 12 weeks, some of which may be continuing or some of which may be new, as the true post-COVID period. From our perspective here at our UAB post-COVID treatment program, we really break people down into whether if it's 4 weeks beyond their initial onset, and consider all those people as being in the post-COVID period. However, there may be some utility to making better designations, and over time, hopefully we'll better understand what are the different factors that are contributing to who is going to develop post-COVID symptoms and who's going to develop really long-term symptoms lasting more than 12 weeks. So I'm hoping that, you know, over the course of time, as we're doing work to understand this, we can better make a designation for who is having these post-COVID symptoms and treatments for them. In fact, some of my colleagues here at UAB, Dr. Nathan Erdman, Dr. Emily Levitan, and Dr. Jeannie Marazzo, are participating or have submitted a proposal for a large grant that's going to study post-COVID across institutions in the United States. And we're certainly hoping that we can contribute to that to get a better understanding of post-COVID. Now, when we think about post-COVID symptoms, people who have symptoms after 4 weeks, these can be affecting many different organ systems. And so I've just listed here some of the most common organ systems. And while this is a respiratory virus, so it's understanding that trouble breathing, chest pain, and cough are common post-COVID symptoms. Actually, when people are asked, fatigue is actually the most common post-COVID symptom that we see. In addition to these very common symptoms, there's some other ones. The persistent loss of smell and taste, and that is often associated with a poor appetite and sometimes with nausea. Many people have ongoing joint and muscle pains. Headaches is a common problem for many people, as well as other neuropsychiatric and cognitive symptoms that I've listed below. Some people have insomnia or trouble sleeping. Not an substantial number of people have ongoing GI symptoms, nausea, vomiting, and diarrhea. There's some people that have blood pressure changes, and this can contribute to dizziness as well as excess sweating. And then to highlight the psychological and cognitive symptoms, irritability, moodiness, anxiety about the diagnosis, problems with memory or difficulty concentrating, and then a sort of a post-traumatic stress period. All of these things can be common manifestations that people report as post-COVID symptoms. Now, there's a fair amount of data that has now been published about post-COVID symptoms, and some of the early data really highlighted people who were hospitalized. So I've added that to this slide, and I just want to highlight that, once again, people who have more severe disease and require hospitalization are more likely to have some of these post-COVID symptoms. And now, whether these are related to the COVID disease or to the requirement of being in the hospital and the ICU, there may be some overlap. And these are some things we have to work out. Nevertheless, in hospitalized patients in these 3 studies that I've listed here, the first study showed that by 30 days, 60% of people had not returned to full normal activity. A second study reported that 40% of people were still not back to normal activity after 60 days. And a third study reported that 50% of people were having trouble walking at a brisk pace for 2 minutes 4 months after their COVID diagnosis. So once again, these are in patients who were hospitalized. So this may be a certain subset, but it is something that we recognize that these are longer symptoms that we would anticipate than someone hospitalized for a similar illness. So, the first thing we really want people to recognize is that they're not alone. There are lots of growing data and literature that you can learn about that can inform what's going on, but you're not the only one if you're experiencing some post-COVID symptoms out there. In fact, some of the earliest data, which I'm sharing with you here, was actually the recognition from Facebook groups. With lockdown, people weren't able to get out and socialize as much, and so people were really using social media. And there was initially a group on Facebook where they called themselves long haulers, and out of that, they formed a research group. And so this is patient-led research. And so because of that, there may be some bias in this that people with symptoms were more likely to report. But of these individuals who went on and completed the survey, a significant proportion, 96% of these individuals, reported ongoing symptoms. And their symptoms were exactly what I mentioned earlier, the most common being fatigue, brain fog, or cognitive issues, cough, shortness of breath, as well as trouble sleeping. And when they asked people how long their symptoms lasted, 9 out of 10 of them had not fully recovered at 4 to 12 weeks after their illness had started. They also asked people about what triggered their symptoms or their worsening of their symptoms. And so there's a variety of responses, but some people reported that exercise or physical and mental activity affected them, and it made it very difficult to return to work. But the largest thing was actually stress. People felt when they were under stressful situations, for whatever reason, that really triggered their symptoms to worsen. So, I think that this was some of the early data that we had, and I do, want to highlight that this was self-report, and people who were having symptoms were more likely to complete the survey. We've had more data since then come out, and I'm just sharing two studies here with you just to highlight a little differential aspect. And for both of these studies, what they did is they looked at individuals who were diagnosed with COVID, and then they followed the cohort of individuals over time who were willing to report symptoms. A key thing is there were some of these individuals, a not insignificant number of people post-COVID, continued to have symptoms 1, 3, and even 6 months after their infection. The first study that I just want to highlight is from the University of Washington, where they followed 234 individuals who were hospitalized with COVID. Now, the good news is this number is much lower than in the previous study, but still 31% of people continued to have symptoms longer than 4 weeks or 28 days after they were released from the hospital. And you can see the common symptoms. Once again, fatigue, loss of smell, and brain fog were the 3 most common symptoms. A second study that was done in the US and the UK, as well as in Sweden, included over 4,000 individuals. Now, this was a mix of individuals, a very low proportion of people who were hospitalized, actually. And what they reported in this more heterogeneous population was that 13% of individuals reported symptoms longer than 4 weeks or 28 days. And so the common symptoms, once again, you see fatigue, headache, respiratory symptoms, and then a persistent loss of smell and taste. So when I think about the patients that I'm seeing, I believe that what we're seeing is the spectrum is probably more on the range, of 10 to 20% of people are having persistent symptoms that last beyond 4 weeks. And that's not to minimize them. I think that's still a significant number of people, but it's much better than saying that 100% or 96% of people end up with long symptoms. But it also gives us a sense there must be some mechanism that's triggering for these individuals who are developing symptoms, and therefore we can anticipate, as we understand the disease process better, we can develop treatments that can ameliorate their disease. The goal is really, we want to get people back to their normal baseline function. And that's the challenge, as I said, for these hospitalized patients. Many of them are left with months of disability, inability to return to their usual functions. So I guess what to expect? I mean, the first thing, it is not abnormal to have persistent symptoms. It's common to have persistent symptoms after COVID-19, and it is a spectrum of symptoms, some of which may be related to how much virus someone gets. Some of it may be related to behavioral things, and some of it may be to underlying medical conditions that a person has. Common symptoms include fatigue. In fact, fatigue is the most common and the most durable of the post-COVID symptoms. Respiratory symptoms are common. Both shortness and breath and cough are commonly reported. And then poor memory and concentration are manifestations of neurologic and neuropsychiatric symptoms that we see. The good news is most people recuperate without requiring medical attention, and their symptoms resolve by 12 weeks. However, with people with persistent symptoms, multiple different symptoms, they may need evaluation. And furthermore, for people who are having symptoms that are affecting their ability to return to normal or do their activities of daily life, that may be an indication that they should also seek care or additional evaluation. In terms of thinking about what are your options for treatment, the first and foremost thing I would highly recommend is that if people have a regular medical provider, is to talk to your primary care provider or other regular specialists you might see to see if they can manage common non-critical symptoms. So for instance, if you're having respiratory symptoms, which are not uncommon, people might have reactive airway disease or some shortness of breath with activity. Perhaps all you need is a brief period of an inhaler that your primary care provider can give. However, if someone is having serious, long-term physical and psychological symptoms, and particularly those that are interfering with your activities of daily life, it may be reasonable to ask for a referral to a specialist. And so that's what we created the UAB post-COVID treatment program for. And that's been open and ongoing since November. As I mentioned, last year when we first started seeing patients with acute COVID, we recognized a subset of patients who were having persistent symptoms. And initially, the most common symptoms that we were seeing people complain of beyond 4 weeks were people with respiratory symptoms. So we quickly partnered with one of our pulmonologist, Dr. Raval, who'll be speaking to you later this month. And he began seeing people both in the COVID clinic, but then also in his own clinic. But we recognized that there were other symptoms that were very common as well. People with cardiac complaints, heart issues, as well as people with neurology issues or psychiatric issues. And so these were things that we rapidly added. There were a number of people with gastrointestinal issues. And so we partnered with Ashley Carty to start seeing those patients. And then rashes are very common as well. So once again, getting dermatology. We've also got ENT doctors that help for people with difficulty with smell and taste, as well as people who have difficulty with speaking or phonation after COVID. And then we have infectious diseases and general medicine who are seeing patients as well. So we're really covering the spectrum of diseases that we're seeing. And we also have referrals in hepatology, liver disease, as well as kidney disease, although the need for those is much lower than the ones I have listed here. So once again, with the program details, first we encourage patients to follow up with their primary care provider. Once again, they may be able to help with many of the common symptoms or the less severe symptoms. However, there are certain groups who are more likely to require evaluation, and we encourage them to do so through the post-COVID treatment program. For instance, if people were hospitalized, they may have had a greater risk for more serious or prolonged problems. If it's been more than 4 weeks and people's symptoms started and they're persisting, or if they've experienced new symptoms, once again, these would be reasons to seek specialized care. And once again, if your primary care provider or other specialist refers you, we're more than happy to see patients and try to help you get better from these symptoms. So just some final key points. We still have COVID in our area, and while the numbers are much lower, we should always continue to be vigilant and follow the guidance that we have. I would encourage everybody to go out and get vaccinated, and I'm happy to address vaccine issues in the setting of post-COVID if there are questions that arise with that. Many people have ongoing physical or neuropsychiatric symptoms even months after it begins. And these need to be recognized, particularly if they're affecting your ability to carry out your usual activities. I would really encourage you to seek care for those. Common symptoms, for which we're seeing people include fatigue, respiratory symptoms like shortness of breath or cough. We also see people that have persistent loss of smell and taste. This can really impact your ability to get back to your normal life. People that have headaches or cognitive or concentration issues are seeing our psychologists as well as our neurologists to help develop treatments to improve these symptoms. And then stomach and digestive symptoms are common as well. All of these would be good reasons to get referred to see us. If your primary care provider is unable to address these, we're more than happy to try to help. And particularly if you have ongoing or worsening symptoms, we encourage you to seek further evaluation. I've listed a link here as well as you can find this on the website where you can link up and get referred into the post-COVID program. So I just want to highlight once again, that's an overview, and I know that's a really kind of a very broad overview of post-COVID, but I certainly hope that you'll take time to join us over the next 8 weeks or so and see some of our subspecialists. Next week, Dr. Gil Perry we'll be talking about symptoms of COVID and the cardiovascular system. I think you'll find that, to be very informative and helpful, not just for those who are having those symptoms, but for everyone. And you can see there a list of all the other specialists who are going to be working with us in the program and who have agreed to come on and talk about some of these symptoms. I always tell my patients, knowledge is power. The more that you understand about your body and your disease, the better you are able to stay healthy and prevent disease progression. Thank you for listening to my talk. Now let's see, I bet there are some questions out there. Jennifer?
Thank you, Dr. Overton. Okay, so we're going to start the Q&A portion. First question, Dr. Overton, is how soon do you think a booster will be available?
A booster vaccine? Oh, that's a great question. I think we're still understanding what the durability of the vaccine responses is. First and foremost, I would encourage everybody to get vaccinated. Even if you've already had COVID-19, the immunity from the natural infection doesn't appear to be as robust as the immune response from the vaccine. Furthermore, people who have previously had COVID tend to have a more broad and better response to the vaccine than those individuals who have not previously had COVID. So I would really encourage everybody to get vaccinated. If we're going to get our world back to normal, that's our path forward. It does look like that we will require boosters at some time, but I think we need more data. The good news with the Pfizer and the Moderna vaccine, which are these mRNA vaccines that require 2 doses, what we're learning is that out to 9 months, it appears that people still have robust antibodies, and antibodies are the key part of your immune response that bind the virus and stop it from replicating. So these are the guys, these responses to these vaccines, what are really critical to protect us against COVID. So, we probably will require a booster vaccine, and we'll see. Hopefully it won't be an annual vaccine like our flu vaccine, but we just have to wait and see.
Okay, second question. What information is there on post-vaccine and post-COVID type symptoms like new joint pain?
Yeah, so I think the early data on the vaccines, there were 44,000 patients in one of the mRNA studies, and I think 60,000 in the other. And what we took away from those studies is that the vaccine was both safe and effective at preventing severe disease, which is exactly what we want. These have been tremendous vaccines. I think as we've now rolled out millions of vaccines in the US and nearly 3 billion vaccines globally against COVID, there's some common side effects that people experience. So most of these are similar to side effects people have from other vaccines. So local reactions like soreness at the injection site, fever, muscle aches, sometimes joint pains, chills, fatigue. The good news with most of these is that they're self-limited. So for the most part, these post-vaccine effects only appear to happen to last about 48 hours. So that's very good. There's been some interesting data that's come out for people who have post-COVID symptoms and the role of vaccines. It actually appears that for some patients, the vaccine can actually help ameliorate or reduce the symptoms that people experience post-COVID. And there's 2 good explanations that we think may be contributing to this. The first is that when people develop COVID, some people have, most of us develop an immune response, but some people kind of experience an exuberant immune response. So it's sort of inflammatory, and it almost borders on sort of an autoimmune response where your immune system starts targeting yourself. So in those individuals, it may be that the vaccine is actually shutting down that sort of autoimmune or hyperimmune syndrome that people are experiencing. So some people actually experience an improvement in symptoms. The second potential theory is that for some individuals, there may be some sanctuary sites in the body where the virus continues to replicate. And the vaccine is able to induce high antibodies that can target that virus and shut it down, and thereby reduce the symptoms that they're having. In a study from the UK where they followed people who had previously had infection, 900 people who had infection and had ongoing post-COVID symptoms, nearly 60% of them saw improvement in their symptoms in the 2 weeks after vaccination. Now, about 25% of them saw no change in their symptoms, and there were about 18 or 19% of people who actually experienced a worsening. But I think this reinforces the data that potentially these vaccines may actually help people with post-COVID symptoms.
So there are so many opinions about how to treat long COVID, but nothing certain. Is there anything that definitely helps in all?
Yeah, I think that's a great question. You know, one of the challenges is there may be many different mechanisms that are driving these post-COVID symptoms. So because of that, there's no one single treatment. There may be factors that are related to the virus. There may be factors related to underlying medical conditions or behavioral factors, as well as host genetics and our inflammatory response. So there's not one single magic bullet to treat post-COVID symptoms. I think first and foremost, patience and recognition that it may take time for some of these symptoms to get better. For some of the symptoms, there may be very targeted therapy. So for instance, for people who develop reactive airway disease or a post-COVID bronchitis, they may benefit very rapidly from treatment of those symptoms. Similarly, some people with some of the cognitive issues or brain fog, there's some definitely strong data that support doing some cognitive behavioral therapy can really help with some of these symptoms. So I think it's a challenge. We don't have a single treatment that will effectively cure people of all of these symptoms, but I think that we are developing some strategies for each of them individually based on the underlying process that's driving them, as well as the area of the body that's affected by these symptoms.
At one time, natural immunity post-COVID infection lasted 90 days. Later studies extended that time frame. What's the latest?
That's a great question. So I think we're learning more about the durability of immunity after COVID. You know, depending on how severe your illness is, it appears that people have more severe illness develop better antibodies against the virus. And that makes sense. If you're more sick, if you have more virus, then you're gonna mount a bigger response. Initially, like you said, we thought that these responses lasted about 90 days. And so we've told people you're probably protected from reinfection in 90 days. And our employees, we didn't see reinfections in people until after 12 weeks. Now we have seen some reinfections. The good news is there were some recent data from the NIH where they looked at patients who had COVID and they looked at their antibody response. And in this group, 98% of people had antibodies at 1 month. And then when they looked again 8 months later, still over 90% of those individuals still had antibodies to COVID. So I think that's really reassuring. So we also talk about cellular immunity or T cells. That's the other part of our immune system. They also saw that a significant number of these people, nearly 90%, had continued cellular or T cell immunity, suggesting they had memory to the virus and could respond if they were challenged with it again. So, you know, once again, it looks like it may be more durable than 90 days, but we still need to learn more. Are the antibodies that people have circulating, are these antibodies neutralizing? Do they shut down the virus from replicating? We don't know that about everyone. What I can say is we find that when people get vaccinated post-COVID, they get a very broad neutralizing response that's very effective, not just against the wild type COVID virus, but also has activity against some of the variants that we're concerned about.
And so this question's kind of an add-on to that one, kind of building on. What are the reliable labs to use for analyzing COVID-19 antibody levels? Can T cell responses be measured?
Those are good questions. So antibodies, once again, are a protein that our immune system makes to fight viruses. And so these circulate in our blood and they can be pretty readily measured. In fact, we measure them a lot for different medical conditions. In this case, what we have is we have an antibody that just measures whether your body has mounted an immune response against COVID. And that's a very good test to tell us whether a person has previously been infected with COVID, but it doesn't necessarily tell us whether they have true protection, because not all the antibodies are the same. Some antibodies just bind the virus and don't clear it, while others truly neutralize it and lead to killing of the virus. So I think we don't have really good commercially available antibody tests that can tell us if someone has protection. It can tell us whether they've had previous infection. There are specialty labs that do for research that do a much better job of telling us exactly what type of antibodies a person has and what those functional ability of those antibodies is. In terms of cellular immunity, we don't tend to routinely test that. It's very complicated to test the T cells, and they're very sensitive, so you have to use very careful lab-based analyses. So that's not something we generally do on large scale. In general, when we do vaccine trials, we will store some of the people's blood to be able to assess their T cells, but that's not something that's done generally for the whole population.
What impact is made when your immune system is weakened from fighting COVID and allows dormant virus to awaken in your body?
Yeah, anytime we have a stressor, then other viruses that are in our body, we're confronted with viruses all the time. We don't think about that. When people have cold sores or mouth ulcers, these are often due to a latent virus that is reactivated. And so there's usually some stressor that causes that. So we can see some other viruses reactivate when people have COVID. A lot of the long-term viruses are things like herpes virus or cytomegalovirus. These can reactivate when people have COVID. We've seen people who develop shingles in this period as well. And once again, it's because of the stress of this acute COVID infection allows these other viruses to reactivate, and they can sometimes cause disease.
Will my fatigue ever go away?
That's a great question. I think people have to be patient and to see the fatigue get better. Hopefully it will. There is a subset of patients who out to 12 and weeks and longer are continuing to have. And fatigue of all the symptoms is the one that appears to be the longest lasting or the most durable. We don't have great treatments for fatigue. There are many other viruses and infectious diseases that we've seen people have sort of a post-viral fatigue syndrome, and we don't have good treatments for those either. And so that's something to really work on and try to strive to get a treatment. I would say continue to try to be active and advance your activity as tolerated.
Is there anything that can be done to restore loss of taste and smell?
Yeah, so that's really an interesting thing. And yes, it can be. And so, the good news is the majority of people who lose their sense of smell and taste regain it, usually by 4 weeks. But there are these people who have persistent symptoms, persistent loss of smell and taste. And there is some smell retraining. Later in the series, we'll have one of our ENT doctors come on and talk about that. But they have an approach to how to retrain your sense of smell, and usually then your sense of taste comes back as well.
Can you lose your sense of smell but retain your sense of taste?
Yeah, you can, absolutely. So those two senses are very intertwined, but the taste buds generally are not affected as much by COVID as your olfactory sense and your sense of smell. And so people can maintain a sense of taste. Generally, the sense of taste is not as good as it was because we really depend on our sense of smell to help our sense of taste. But definitely people can continue to taste kind of the 5 basic tastes. And then as their smell comes back, they get a more full sense of taste.
Is there any legitimacy to using natural/herbal remedies such as white pine needle tea to address post-COVID brain fog?
Yeah, that's a great question. I think there's very limited information to help guide us on some homeopathic regimens. I would recommend a diet that's rich in fresh fruits and vegetables and antioxidants. Those things may help. But I'm not sure that some of the homeopathic or the herbal remedies, there's just not enough data to tell us whether or not they can help. And the main thing you want to make sure you do is not do anything detrimental to your health or interact with any medicines that you might be on.
What is the best known treatment for brain fog lasting 5 months?
So somebody that is continuing to have concentration issues, I really think that that's good person to consider getting in for neuropsychology testing. I mean, we have really an outstanding neuropsychologist that we're working with, and what she does is really does a formal assessment to really identify what the what the issues are, what the defects are, and then develop strategies to improve those. For some people, some cognitive behavioral training can really help improve some of these brain fog symptoms. She also works closely with our neurologist, and you'll be hearing from both of these two, Dr. Locken as well as Dr. Agnihotri, later in the series to talk about these issues, because I definitely think as we get further out, the neurocognitive symptoms are, commonly seen. And I would really encourage people to be willing to seek care. I think a lot of times we feel a lot of stress or stigma if we're having issues with our cognition or with our mood. And, I think that this may be a manifestation of the disease, and I would encourage people to seek care if that is really impairing their ability to do their activities of daily living.
Are the headaches and brain fog symptoms of brain inflammation?
Yeah, they're probably, I mentioned earlier that there's probably an overexuberant inflammatory response to the virus that drives some of this. The brain is a very protected part of our body, but so some of the things that we generate, some of these inflammatory molecules can get across the blood-brain barrier and then cause inflammation in the brain. So absolutely, I think there is a component of hyperinflammation that's driving some of these brain and neurology symptoms.
What are post-COVID skin rashes usually related to? Some rashes look like sunburns.
Rashes are one of the most challenging things to anybody who practices medicine. But there is really, it's interesting. There's a wide variety of what we're seeing in terms of rashes. So depending on the series you look at, somewhere between 1 and 20% of people in different series have rashes, although it seems like probably somewhere between 7 and 9% of people are having some sort of skin response to this. And there's some different types of skin rashes that people get. So the first thing is people might see little red bumps that they get that are sort of a viral exanthem, so to speak. So it's like they're having an acute viral illness, and you might see these. Another type of rash that people get is more what we call urticaria or hives, where people have a kind of an allergic reaction. And this is usually a self-limited, lasting no more than 5 days, and is often responsive to things like Benadryl and sometimes steroids if needed. And the third thing is kind of a more interesting area, which is what we call an acral rash, or a rash that affects the hands and the feet. Early on, there were these cases of what people were hearing as COVID toes. And this is probably a couple of different things may be driving that. So I mentioned earlier that COVID infects vascular cells. And so part of this may be sort of a vascular effect, and we're getting that type of rash. It also may be related to this hyperinflammation syndrome. One of our dermatologists will be joining us later as well. And I think, the skin is so prominent, it's obviously it's something we see every day. And so when people are having rashes, those can be, very limiting what you feel comfortable doing. So I think it's very important that people hear and learn about rashes and what they can do. And I would encourage you to come when Dr. Elston presents later this summer and hear her presentation.
I've had horrible skin rashes since getting COVID that only respond to oral steroids. What can cause this?
Yeah, I mean, so just to recapitulate, there are a lot of different mechanisms that may be driving this. You may have the fact that it's responsive to steroids really suggests that this is sort of a autoimmune or a hyper inflammatory syndrome that's driving that. And every time a person takes steroids, it kind of ameliorates or reduces those symptoms. But you don't want to take too many steroids, because those can have effects increasing your risk for diabetes, as well as reducing your bone mineral density. I think if these are coming back after you've taken the steroids, that may be a reason to get referred to see a dermatologist to get a better evaluation, to understand if there are alternative approaches to resolve this rash.
So we've had two questions on this topic, so I'm going to kind of put them together. First one, have you seen any temporary vocal cord paralysis in asymptomatic patients? Second one, do we know what causes vocal cord paralysis after COVID? This person was asymptomatic, and I'm just now starting to get my voice back. It's been 20 weeks.
Yeah, so I mentioned earlier, there's a small subset of people that really have difficulty with speaking or what's termed phonation post-COVID. And we do have some of our ENT doctors who are seeing patients for these issues. I'm not an expert in why people get vocal cord paralysis, but I once again would make the assumption that it's related to the hyperinflammation. We often, I'm interested that this person was asymptomatic other than the vocal cord paralysis. We often see this in people with more severe disease. And sometimes it's hard to overlap if these are people who have been intubated, and so therefore the intubation and the time on the ventilator affected their vocal cords, as well as the COVID itself. But given that this person was asymptomatic, I wonder if it was more related to, some inflammatory response to the virus. But, once again, for people who are having difficulty with phonation or speaking, or, a concern for vocal cord paralysis, once again, we have specialists who are seeing patients in that area.
Is there a record of persons experiencing repeat acute cases of COVID versus long haulers? If so, how many have had multiple cases?
Yeah, I mean, I think we've seen a number of people. I don't have an absolute number. Early on, when we started seeing some recurrent employees come back with a new illness, it's a little bit challenging to absolutely know, because it's possible, that they could still be shedding virus. But we've seen people who were clearly beyond the period when they should have been still shedding virus. In fact, we had seen people who cleared their virus and then subsequently had a positive test again. So yes, it happens. People can get reinfected, and that's what I mentioned earlier. Despite the fact that we can look and see many people have antibodies, these antibodies that people make to the natural infection aren't always protective against a subsequent infection. Now, the good news is, once again, with the vaccine, those antibodies are more likely to be protective. But we have seen people who have been infected as many as 3 times, I can tell you. And the cases that stick out to me are people who are immunocompromised in general. So their immune system is abnormal and they're not mounting a normal immune response. But we've seen normal hosts who had a mild first case and then had a more severe second case. So perhaps what happened for them is that they cleared the virus but didn't develop a really robust immune response.
This question, if you had a severe case and developed a high number of antibodies already, how can the vaccination protect you more? Won't the natural antibodies protect you?
Yeah, that's a good question. Not necessarily. So, these viruses are kind of crafty or smart. So they're going to show us parts of them that may not be critical to their success in replicating. And so they cause us to make an antibody to a non-essential part of the virus, or to a part of the virus that they can mutate that part and still be functional. What we have seen is that people who have had past COVID infection and get vaccinated, they get very high level antibody responses and more broad antibodies that protect them, not just against the main COVID type, but also from some of these variants that we're worried about. So I would really encourage people to get vaccinated. I think it gives you a significant improvement in terms of your immune protection. And that initial infection serves as kind of a priming of the immune system. And then the vaccine boosts your immune system so you have broad protection against many different COVID types.
And then, so we're running short on time, so we're going to do one more question. Will you go over herd immunity in regards to Alabama?
Sure. So, herd immunity is a term that we use when we can get enough of the population with antibodies, either from natural infection or vaccination, such that a virus is not able to jump from person to person. And remember, this virus is kind of sneaky in that people are asymptomatic for up to 5 days before they develop symptoms. And during this time when they're asymptomatic is when they're actually shedding the most virus and have and can actually give it to someone they're with. And so this is a respiratory virus, so it's generally spread, person to person when we're talking to one another. And so if you can get the number of people who have pre-existing immunity, it means they're less of the population to get infected. So if we can get the number of the population up to 70% who have immunity, either from natural infection or from vaccine, then we can feel confident there won't be enough people who are at risk for infection to spread it through the population. So that's really the thinking behind that. So the goal is to get 70% of the people with immunity. Right now, our state is not doing very well in vaccination rollout. We're kind of down at the very bottom of the number of people who are vaccinated in our state. Mississippi and Alabama are the only two states in the nation who are below 30% in terms of our adult population having been fully vaccinated. So I would really encourage people to go out and get vaccinated. If we can raise the number of people with immunity, we can get back to normal sooner and feel comfortable about getting back to our normal lives.
Thank you, Dr. Overton, and thank you for joining us. We hope this information has been helpful and informative. To register for other post-COVID Lunch and Learns or to view a recording of today's session along with the Q&A, visit uabmedicine.org/post-COVID.
Thanks, Jennifer. Thanks, everybody.